can get started now. Thank you very much for being here. My name is Robert Scott Bell, and I actually get to sit down for once. So we got a nice, lovely, small panel, but on a very, very large issue. Now, I don't know whose bright idea it was to ask me to do one on mental health, because look at me, come on. A picture of mental health? I don't think so. But a very, very important topic. When I learned that we were going to have this topic here at the Health Freedom Expo, I thought couldn't be more timely. Even though we know at Trinity and all the things we do are body, mind, and spirit connected, the 1.5 to 2 years of intense fear-mongering has wreaked havoc on every age group. Even people who have a generally sunny disposition and outlook have been challenged like never before, at least in my lifetime. So I'm grateful that this topic is here today. I'm going to hang out with these folks, Dr. Todd Frisch, Dr. Caroline Leaf, and Dr. Jim Evans, and all that they do that is so amazing and wonderful. As far as I know, biblical coaching type concepts. Dr. Evans, we're going to get into a little bit with Trinity. And Dr. Caroline Leaf, you were amazing in your speech last night over dinner on mental health issues, coming all the way from South Africa, correct?
I live in Texas.
But now in Texas, okay? But the accent is not Texas, I can tell you that. And Dr. Todd Frisch, who's amazing. I met him, was it last year or long ago? 2 years ago we connected?
Yeah, Truth About Cancer.
Truth About Cancer, that's right. And if you've not seen his book, Why the Face, my gosh, it's just so amazing. I can't wait to get you on my program. In fact, all of you. So with that, we're going to start, and I'm going to sit. Again, bear with me. I'm going to sit down. Everybody's okay? Can I do that? This is awesome. Oh, I'm sitting down. First question, and it'll go to y'all about this year we have been living in, unlike any other year, except I will say that if you've lived in South Africa and you've been through apartheid and coming out of it, there are certainly challenges that most Americans have not lived through in terms of that intensity. But if we can get a perspective on the mental health challenges we've seen in America since you've been here as well, we'll start with you, Dr. Caroline Leaf, that are unique to this time, and maybe some let's say, is there a sense of urgency associated with what's going on, or am I exaggerating things?
Thank you so much. Can you all hear me? I have such a quiet voice. I'm a speaker with the quietest voice out. So, okay. So when it comes to mental health, to answer that question, we've always battled with mental health. This is not something new. So I think we need to get everything into perspective. Every generation faces something. You know, there was the wars and there's all kinds of things. So yes, we are in a unique situation now, but there have been other unique situations generationally. So I always like to just get everything in perspective first of all. So mental health has been with us since the beginning. Battling with mental health has been with us since the beginning of time, because we're humans and we have adverse experiences, and those are inevitable because we can't control events and circumstances. We can't control people. So it's going to happen. What has happened, obviously, over this intensive time now is that we're speaking more about it, which is a great thing. Mental health has always been mismanaged. It's just never been a really good area of, we look at the historical trends of how mental health has been managed. It's been a very, very sad situation. And I like to distinguish between severe mental health and what's normal in mental health. So I talk about the concept of, let's talk about the fact that it's been a messy time. But it's always been a messy time for humans. This is its own unique messy time, and it's okay for us to feel a mess in this mess. It's a very normal response. When the mess accumulates, we can get into severe states. It doesn't mean that we've suddenly also now got a viral thing happening in our brain in terms of mental illness. I don't like to talk about mental illness per se. I'd rather talk about how we're managing the mess that we're in and how extreme is that state going. And so with the accumulation of everything that's happened, it's been very extreme, so we're having extreme responses. So I would say the extreme responses that we're having are actually normal considering the circumstances. And what we need to really do is to continue the discussion. So it's really great to have these kind of panels. So we hear scary statistics like there's been a 30% increase in severe anxiety and severe depression and so on. And I stress severe because there is a normal level of anxiety and depression, etc. That's very normal. It's a very normal part of being a human. But there's an increase in the severity because when things accumulate so quickly, people will get knocked over in various ways. Job losses, grief, the financial implications that have happened over the pandemic, those kind of things have always been with us, but they've been intensified. So we've had such an intensified state, so that's also contributed to the situation. Where I see the problem is that there's been a lack of management. Instead of us talking about it more, instead of us bringing together the incredible research that's been around and that is happening, we have been fear-mongering, as you said, that there's been a lot of, mental health is the next pandemic. And I keep saying, no, for the first time in a long time, we're actually allowing ourselves to talk about mental health. We are expressing how we're feeling. We're saying we feel sad, and that's a good thing, because when you get it out, that's very healthy. If as soon as it goes into your brain and your body, it's going to mess you up. So, I mean, there's a lot more I can say about that, but that's kind of a general overview of how I would approach the situation.
Thank you, Dr. Lee.
Could I say one more thing? Even prior to the pandemic, there's something that we didn't speak about, which is even more important. No, that's wrong. Let me rephrase that. That is as important. We entered the pandemic mental health era with already a pretty disastrous mental health situation, where we had what they call deaths of despair. People are dying 8 to 25 years younger for the first time in decades from preventable lifestyle issues. And they're tracking that back to how we are managing our minds and the whole kind of things that we're talking about at this conference. So there's so much that we already hit an era just prior to the pandemic of problems. Then we have the pandemic. So we've got these two big things on top of each other. And the great part of this is it's forced us to have conversations. We've got to change how we do mental health and how we do medicine.
Well, and of course, we've been told we shouldn't speak up, or if we do speak up, we're learning that censorship has become the norm. Like, we can't have that said, certain things said. So we feel this isolation. And I think going biblical, Dr. Jim Evans, when we talk about going biblical, you get, okay, what's going on now? But the commandments and other things from God, were they to isolate and hide from one another, to look at one another as vectors for disease, decay, death, degeneration? Or is there somebody has taken control of the narrative and really warped it so we all have this mental aberration?
Well, Robert, most of the time, and for almost 20 years, I've been counseling in my little office, and my partners and I have a counseling center in Terre Haute, Indiana, about 3 hours south of here. So for almost 20 years, I've been working with one or two or three at a time. I usually ask to start the appointment, who called for the appointment? So I'm not sure who called for this appointment, but there's a lot of people here that are worried about and concerned about so much going on. And Dr. Leaf said last night and today, I see it being cumulative is the biggest problem that we see in our office. As she has said, people acting irrationally, unkind, unpredictable has been from the very beginning. Look at Genesis 3, Genesis 4, the chaos that ensued. It wasn't that Adam and Eve didn't know, it's just that they wouldn't do. And their offspring, Cain and Abel, ran into serious problems very quickly. Mental health, certainly behavior issues from the very beginning. And what we've seen in our office as the unrest has continued is the fear and the anxiousness and the depression has continued to widen throughout the population. Not only, and I attributed a lot of it to isolation because we've been so very isolated. And people very well educated. I've even worked with several clinical psychologists who were so concerned and anxious that wanted to incorporate their faith into the work. So professional people now are have become very concerned, especially as the authority figures that we've trusted for so long have become unreliable. Who do I trust? And that seems to be from the faith-based perspective. Listen, we live in a dangerous world, and that's been from the very beginning too. I am not sure God is particularly interested in us being comfortable. I can't find that in the Bible anywhere. Faithful and steadfast and reliant upon Him, absolutely. Comfortable, don't see it.
Yeah, some have said, I would rather take charge of what we call a dangerous freedom or liberty than a peaceful enslavement. And I think even of the mind, the enslavement of the mind, that as we are being bombarded with messages and engrams and visions of fear, again, we come back to this theme of children being taught that if they breathe, they're going to kill grandma. I mean, what a horrific thing to teach our children. I certainly don't find that anywhere in the Bible. Dr. Todd Frisch, you have taught and are teaching a lot about this facial kind of recognition.
Sure.
You can look at faces. I'm thinking, the faces you've seen in the last year and a half, have they changed a lot?
You know, it's interesting. The face is a microsystem, and everything that happens is somehow imprinted in every cell, and that will manifest itself. We have foot reflexology, we have auriculotherapy in acupuncture, hand reflexology, iridology, great iridologist here. These things are going to be marked in our body, but they're also going to be marked in our heart. And this area of the body is the spleen. Now, spleen is about immune function. Our B cells are made there, beta cells. But it's also our happiness center. And if I've seen one thing that is consistent is everybody's temples are bowing inward. There's just a lack of joy in this country and in this world. I can only speak for this country. Let me know about South Africa. But this is really about what I call the 2 F's. I always taught this to my patients. You can live by faith, you can live by fear. And if you read her work, fear is immunosuppressive. There are people in the hospital that happen to have COVID, but they're dying from fear because it's killing their systems. That's not a biblical principle. Marcus Aurelius, a Roman emperor, I guess, around the time of Christ, he's quoted, "What stands in the way becomes the way." We as Christians need to take this on. It's no longer time to be meek. We have to attack this thing. It's standing in our way to what is correct and true, and we need to go right at it.
So is it true as well, and Dr. Leaf, you can add into this, that in these times of challenge, do we have the greatest opportunities to make leaps in growth, or is it only in those calm, peaceful moments where people make those leaps of understanding? What have you found in clinical?
As a clinical neuroscientist and researcher, I've been doing this now for 38 years now, it's in the mess that we repair and grow. And I'm very grateful, and this may sound very odd, but I'm very grateful for the mess that we're in mentally now, because we cannot carry on doing what we were doing. It has not worked. You know, I don't know if any of you watched Ted Lasso, but it's just got such great life stories in it. And there's one where the psychologist says, I've got to become your tormentor before I can be your mentor. And it's almost like that, you know, and I see that in therapy and in the work I've done in the research, you get that, what we call a treatment effect. And it's kind of cycling. Like every sort of 3 weeks, your mind-brain connection goes through these various phases. And you hit these peaks more or less these different peaks, but there's like a major peak that happens more or less every 3 weeks. And when someone's starting to deal with stuff, there's tremendous torment. When you start seeing the pain when you start facing instead of suppressing, there is a whole shift in your neurophysiology that feels terrible, but it's actually a mess that can now be repaired and grown. And so those peaks we call the treatment effect. So yes, we've got to get messy to be able to. It's such a scientific principle.
You know, I wish I'd have known this when I was a kid, talking to my mom about my messy room. I'm like, Mom, but it's the best opportunity, right? We got to grow here, right? But truly, coming through these strange times, if you will. I mean, I look at my own life, and my physical health challenges have brought me to where I am, and they've been my greatest gifts. You know, even as I cursed them at the time, and we're coming through a lot of that. So I believe this is an opportunity for mental and spiritual growth. And thinking biblically, you know, we talk body, mind, spirit. What is the role of how spirit can help heal what's going on now mentally?
Several weeks ago, I had it was a non-COVID flu bug. Didn't feel good for 3 or 4 days. And I want to tell you, in my physical body, I was not interested in the exegesis of the Bible, of the biblical book Daniel. All I wanted to do was sleep. I was not interested in thinking deep thoughts. I just wanted to do was sleep. And Jesus really established the idea of the complexity of the human condition. Several times in the Gospels, he's asked, what is the most important command? And his response was, love the Lord your God with all what? All of your heart, soul, mind, and strength. The 4 aspects of our humanness. And they are intricately related, and you cannot separate them. James 1 says, Jesus' earthly brother says, "Consider it pure joy, my brothers and sisters, when you have experienced trials of many kinds, because when you experience trials, it creates faith, and faith creates perseverance." You know, me, I would rather skip the trials and go to faith and perseverance. Could we do that? But it's all connected. Our mind, our physicality, our emotions, our spirit. If you think about it, our spirit is the only part of us that's going to carry on after we step across the veil. That's what's so intriguing to me about it. The old thing, eat right, work out, and then you die, right? Well, not so with the spirit. It's going to continue. That's my worldview anyway, as a biblical counselor. And so I'm very interested in encouraging people to strengthening their spiritual life, because that's the side that's going to carry on.
Beautiful, thank you. Todd, when you're looking at people in their face, and if you ever have him look at you and he can tell you things, you're like, how do you know that? That's not possible. Or you're a psychic, but he's not. He just knows the face and this ability to track back to what it means in the different areas of the body. But in the midst of these challenges, emotions, the anger, all of the things we're experiencing, have you found that everybody's face indicates strengths and weaknesses that may be, let's say, more challenged than others? Why not everybody's having the same experience, even in this general experience that we're all sharing?
Sure. So when fear is ruling your world, that's the emotion of the water element in traditional Chinese medicine. I was the frisch problem at every church I belonged to because I was always some new age wacko that did all this kind of stuff. And I go, I'm not, and so it was always an interesting experience. But there are these 5 emotions that go with the 5 elements in traditional Chinese medicine. The emotion of the water element is fear. Now, fear, again, back to this faith and fear. Fear lets Satan into your life. Do you want that? Faith doesn't let Satan into your life. Fear does. The emotion of the liver is anger. So if you have an imbalance, and you have a stress hit you, we're all under stress. It's never, are we under stress or are we not? We all are. It's, do you adapt or do you maladapt? And you're going to maladapt to stress in the most weakest area. So if you are a liver person, we have a deep crease here, and you have muscle tension, and you have poor quality nail health. Look at alcoholics' fingernails or toenails, they're all gnarled and yellow. That's because the liver governs that. So these things become diagnostic. Everything that happens to us means something. There is no good or bad. There is no ugly and beautiful. It's all what is. So I would use those things to help me understand what's not right with my patient. I was taught as a doctor to look at what's wrong, and that's fine, but how many of us have had, as practitioners, have had people come in, we know they're sick, they know they're sick, and all their tests are textbook midline normal. So I had a paradigm shift, and I went to, let's ask what's not right, because you got to be 2/3 sick before the medical world sees anything wrong. Mm-hmm. This is a profound thought, and that's a little too late in the game. So whatever is the weak link we manifest. So that liver person, if they're stressed, they're going to get angry. Kindness isn't going to be a big thing. The kidney person is going to have issues with fear. And that's going to be the big thing. If it's a lung, large intestine person, a metal element, then you got a different D word. So many of these people, I see this often in females, they have dry skin, they got these skin problems, they sigh all the time, they can't get their breath. And they've been given antidepressants, SSRIs, for depression. And they not only do they not work, they get worse because the D word that applies to the mental element is despair. Depression is, I'm depressed and this is the reason why. Despair is there's a hopelessness component of that. So the people that are dying from lung issues, they're dying from despair. And that's the emotion that's tearing them down because that's their weak link.
Has anybody seen despair manifest that way? These are things you can commonly find. It's just, I love when I talk to doctors that have clinical and observational experience for years because you can identify and go, wow, I've seen that pattern emerge. And then you can begin to apply that knowledge in your own life to help yourself and others. And that's why we're here, and we're here for you. Now, I'm going to open it up. Do we have a microphone for questions? We do. So you're here for a reason, whatever that may be. Remember, we're not engaged in doctor-patient relationships with questions on mental health, but in a generic sense, we want to hit the principles to apply for, like the book that you've written. It gives people tools to utilize that we can go through these challenges and come out on the other side stronger, better, hopefully happier, more joyful, more filled with the Spirit, which I believe is what I've experienced here with so many of you that have come here, not as victims, but as I really want to get together with people again and enjoy life and uplift and praise one another, etc. So that's what we're here to do. So let's hands up and we've got plenty of time this afternoon at this point. So anybody have a question on mental health or anything related to the topic today of what we've been going through?
Scared them all.
Tell us your name and where you're from, if you don't mind.
Nancy Madrigal from Blue Island. I understand that, well, I've heard it said something like 80% of illness is from emotional and mental. So I guess the question is at this time, what are some tips that you would give us generally, well, to our families as well, to help kind of evaluate, like maybe take an evaluation and then take a few simple steps to improve the mental health that would help improve our physical in the end. Thank you.
Okay, practical tips. I think everybody will have a few. You want to go, Caroline?
Sure. If I could just backtrack just to give a bit of foundation to that, because there's never going to be any one thing that's going to work. You need to work within systems, and it's always going to take time. And so one of the things that I've noticed as a therapist over the years is that if you can get these really great techniques or whatever, processes, tips, but if you don't carry them out persistently for the correct amounts of time, your brain doesn't respond to your mind and doesn't wire them in. So to make that make sense, you have to understand that your mind is separate from your brain. So to link it into what Dr. Jim said and what you've been saying, your mind is your spirit and your soul. So I take the word mind from the research I've done in terms of going back to ancient texts as well as science, etc. Mind I use collectively as the spirit, soul, and then you've got your physical, which is the brain and the body. And the mind drives the brain and the body. And I mentioned this last night for anyone who was here, is that if you are dead, your brain and body are doing nothing. But because you're all alive, you're actually making up to 1 million new cells every second. As you're sitting here listening, in 2 hours' time, multiply that by 1 million times how many seconds, that's how many cells you made in this particular 2-hour time period. And the quality of those cells is those cells then form your systems of your body, the organs and the systems of your body. The quality of those cells is dependent on the quality of your mind, therefore your spirit and your soul and what's going on there. And the spirit and the soul is dependent on what's going on in your environment. In other words, what are you being exposed to and how are you responding to your environment? So to quote one of my favorite quantum physicists, it's not about you, it's about you in the world. So we've got to look at us in the world, and we've got to look at how do we process the world through our mind. That's the answer. So we're processing it through our mind into our brain. So our mind is showing up in our brain, and it's showing up in our body. And that's why we have this link between a toxic emotion or a toxic experience, which is then processed, and you feel that toxic experience as a toxic emotion and in your body and the different parts, and because it's showing up, your mind takes it in. And when we talk about mind, we're talking about think, feel, choose. So it's what you're thinking, it's what you're feeling, and what you're choosing. That's how you kind of make sense of what's coming in. That shows up in your brain responds and builds it into your brain as a neuroplastic change, and that then influences every cell of your body, right down to the level of the DNA, which is why I can make the statement that the quality of how you do that influences the quality of the cells you're making, which then accumulate over time to then impact how you are functioning. Okay, so now reverse that back to answer your question, and it's a big question with a big answer, so I'm going to give you the Cliff Notes version. If mind drives brain and body, What's very interesting to also know is that when someone dies, that there's no million cells being made every second, there's no structural change occurring in the brain, there's nothing happening in the DNA, nothing happens. The brain and body physically start to disintegrate. Also, a person weighs less at death. The spirit and the soul or the mind move out. Okay, so there's a difference in how that body now can respond. So mind is your driving force. So mind is driving the brain and the body. They need each other. You can't say mind is more important because mind shows up in brain and body. So if you're going to manage your mental health, you have to realize you're actually managing your mind. So instead of talking about mental health and mental illness, which is kind of scary, especially the way it's been presented all these hundreds of years, and especially in the last 38 years, where we've become so neuroreductionistic, which means we've become so focused on the physical. It's wonderful advances. I've been involved in neuroscientific research for 38 years. It's phenomenal. But that's not the end of the story. You are not your brain. You tell your brain what to do. Okay, and your brain can get damaged from medications, from traumatic brain injuries, etc., etc. But at the end of the day, what we see is that your mind drives the brain and the body. So therefore, if I'm going to manage my mental health, I need to understand what the mind is. And I need to know how to manage the mind. So one of my big questions was, how do you do that? And can you do that? And how often can you do that? And the simple answer to that is that we can do this every 10 seconds. So your main tip, overarching tip, is that you need to manage your mind through self-regulation every 10 seconds. So I'm not asking you to look at your clock or set off a timer every 10 seconds. It's just a deliberate and intentional, self-regulated way of living your life. So instead of being reactive, it's responsive. You respond, you observe yourself, you stand back and observe yourself, and you manage your mind like that. Now, obviously, that leads down to a lot of other things, but that would be my overarching introduction to this concept.
Thank you. Thank you. Jim, do you have anything to add?
Here's an example. We said earlier today that people in the hospital, COVID, in danger of their life, no question about it, very fearful. That's the fear of something that's very real. Let's talk about anxiety just a bit. Anxiety is different, I think. Let me explain anxiety, the difference. If a bear were to burst into that door, my heart rate would go up, my respiration rate would go up, my blood pressure would go up, because adrenaline would surge through my body instantly, and I would be looking for a way out, maybe through that window, and as the old joke goes, not necessarily outrunning the bear, but outrunning you guys. That's fear. It's something that's real. What I've kind of observed in my office, particularly over the last 18 months, is people are so anxious, oftentimes about something that is not at all real in their life, but could happen. Well, could it happen? Well, sure, things happen all the time. Sometimes the news is very bad, but most of the time it isn't very bad. And so a tip I live by, and I encourage people all the time, is let's stop and talk about what's really true here. What's true in your life at this moment that's got you so amped up, that's got you so worried and staying up nights? Because the truth of the matter is, with the COVID disease and different things, the truth of the matter is, most of the things that we're so anxious about never happen. I mean, that's been shown over and over. Sometimes they do, but most of the time they don't. And so let's stop, take a breath, and really begin to make some notes about what's true in my life right now. Are there any bears around? And most of the time, gang, there aren't any bears around. But wait a minute, it could burst. Yes, it could. But most of the time it doesn't. And so let's sit down, as Dr. Leaf has said, let's get control of this thought and settle down and say, look, I'm healthy. I'm doing all I can. I'm all surrounded by good people, good information. And let's not let my mind get carried away here. And it's incredible if you start doing that on purpose. And I'm a big fan of note taking and journaling about what's really true about my life. It really is very, very helpful to decide and to realize what's true about your life.
To your point, there's actually studies showing that 95%, up to 95% of what we worry about won't happen. So that's, there's a lot of research in that. So just backing up what you're saying.
So Mark Twain once said, of all the stresses in my life, half of them actually happened. So, as a physician, and all this stuff is out there, things you can take for this condition. I'm always fascinated by, let's study where the disease doesn't exist and find out why. Do you know where it doesn't exist? At the equator. What's at the equator hottest? The sun. Vitamin D levels are the highest. That's why you read about vitamin D is so important. And then you read about ivermectin and hydrochloroquine. You read about, you should take zinc, but the zinc can be toxic. And you'll go back and forth. Quercetin is the hot one right now. Everyone needs to take quercetin. It's kind of a natural antihistamine. One of the things I always taught my patients, I would say, what do you think is the most important supplement? And they say, vitamin D. I read a lot about that. And I go, yeah, that's important. But I've been reading about fish oil. And they go, yeah, that's important. So I would always say, here's the most important supplement. This is the most important supplement. And the ladies would always grab their purse and get ready to write. And guys would go, oh. So the most important supplement is the one that's missing. So finding someone that knows what's missing. But all that is fine. But here's the truth, to hitchhike on these two fine doctors. The answer is really simple, and it has to do with vibrational rates. Everything has a vibrational rate, a hertz. The word love has a vibrational rate of 528. There's a horrible book called 528. It's impossible to read, but if you can get through some of the junk, it's got some interesting things. But the word love has a vibration rate of 528. The word hate has a vibration rate of 100. Here's an interesting thing. Cancer, depending on the cancer, has a vibrational rate of 40 to 100. So if you live your life in hate, you're going to attract a vibrational rate there. So cancer is involved with hate. So the answer to this is simple. The vitamin we need is love. What does the Bible say? What is God? God is love. So if I practice, and this is hard today, okay? And those of you that didn't vote for the current president or whatever, it's going to be hard sharing a lovely thought about this guy. And there were so many people that hated Trump. Do you realize the energy that was produced by that kind of thing? The toxic environment that was created? But if you express love, you knock out basically 5 haters. This is a math problem that has to exist today. We can beat this problem simply by hitting a critical mass of enough people sharing love, which is a godly principle, and we knock out hate. It's 5 to 1. We got it whooped, people. That is the vitamin we need.
Beautifully said. Thank you. Yeah. I used to call it vitamin L.
Yeah, vitamin L.
We need some more vitamin L.
I had vitamin F. It was my mother's fudge. Vitamin F had no caloric intake. Amazing vitamin F.
Might indulge in that. That
there you go.
Good. As a homeopath, I've looked at the impact body, mind, spirit connectivity. Certain remedies they have impact that seem to be more physical or emotional or mental. I'll throw out this quick tip. For those of you longtime listeners, you may have heard me say it before. In terms of the swing we have of humanity, often you can be frustrated with something. And that frustration could lead to, I'm angry about the way things are going. And then that anger tires you, you get back and you're frustrated again. Your energy saps down a little lower. Now you're sad, you're depressed. And see, there's swing that happens a lot because we aren't fully engaged in what really matters, perhaps. What is really going to impact us as opposed to what we imagine might, right? The bear that isn't there. The remedies, by the way, if you want to write down a Latin name or 3, if you're dealing with frustration, it's argentum nitricum. Typically, that's the remedy that can trigger it's not like a drug. It doesn't go, it just helps you to process somehow. Argentum nitricum, which is silver nitrate, by the way, but in homeopathic form. If you get very angry, one of the most common remedies for intense anger is stramonium. Stramonium, stramonium. It's your Latin lesson.
Absolutely.
When I do this,
Amazing remedy.
my producer says, you're going all Harry Potter on us. Why are you doing that? Talking Latin. And then if you're very sad, again, these are not the only remedies, but these come up again and again, so you can study them. Sepia for sadness or depression a little bit. Inky juice of the cuttlefish, for those of you who want to know what that is. So questions coming out. Any other questions? Yes, in the back of the room. I won't call you by your nickname that I gave you earlier today.
You know how many people in the hallway are calling me?
It's too late. I'm sorry.
Oh my God.
It's a healthy thing, though.
I got to remember my question here. Oh, okay. So with mental health, a lot of that is the opinion of some quote unquote expert telling the recipient, saying, there's a problem here. You have symptoms, syndrome, I don't know, disorder. I've heard that the mental health books that they use are like nothing but disorders, and there's nothing that is like orderly or something. So my question is,
And they're getting thicker. Those
and
books.
yeah, right. There's more disorders, right? So
In both senses.
how? I don't know if you could put an actual percentage on it, but maybe majority, minority, anything along those lines. Just comments on how much of what people think themselves of having a disorder, meaning there's something wrong with me. I shouldn't feel this way. I shouldn't think this. I shouldn't be unhappy. I'm shy and I have antisocial disorder now or something. How much of that is actually not wrong? And just, you know, like if your friend dies, you're sad. That's part of the mourning process. But it'd be easy for somebody to come along and say, oh, don't be sad. You shouldn't be sad. That's wrong. Yeah, that's wrong that I'm sad. How much of all of this mental disorders is actually appropriate responses, but somebody's telling them that it's a disorder, when actually it's a pretty normal reaction to the crazy world we live in?
I think the world's authority on this should answer that. So, Dr. Leaf, you want to?
Thank you.
Sorry, not to take your
Well,
job.
that's
Get off the stage.
I
will you,
was
please?
going to go take a nap now. Thank you, Tom.
I got this. That's good.
Such a good question, such an important question. The DSM and the ICD were birthed about 40, 50 years ago, and it was birthed by a group of people sitting and saying, oh, we think these symptoms are these and this and that. And it's what we call a tautology. So you lose a loved one, and if you're now you're depressed, obviously grief never changes. I mean, grief never goes away. The space around it just gets bigger. But according to that kind of delineation, the symptoms should go away within 3 weeks, otherwise you have a disease. So what they've done with that, and I speak very strongly on this because it's the absolute one of the reasons why people are dying younger is because of the labeling. Because we will live up to, our brain creates predictive patterns. Our mind creates them in the brain, and then our brain literally tells our body what to do, and the mind-brain-body connection happens, and we downgrade those million cells that we're making every second and increase our vulnerability. So yes, the labeling locks us in tremendously. So I don't agree at all with any of those disorder names because they're tautologies. You go in, you'll say, these are my symptoms. You have this clinical depression. Why? Because those are your symptoms. Why? Because that's the disease. Can you see it's a tautology? So it doesn't give you anything. It's a gift that actually has nothing in it. So initially, when people are very, very in extreme states of depression or anxiety, it's overwhelming because of our societal management of it. We're not allowed to process. There's something wrong with you. There's not something wrong with you. You're being human. If you've been raped or abused or you've lost a loved one, it would be inhuman not to be sad or not to be anxious or not to go through those things. So emotions should never be seen as illnesses, but they are. They're seen as illnesses and as brain diseases. And that is so wrong and so unscientific and has actually not even been correctly shown to be. If you look at the scientific studies, I've spent 30 years doing this, it is really not telling the true story. The true story is that we are humans going through stuff, and we're all going to respond in our own unique way. And putting a label on is that gift, as I said, that's empty. You open it up, now what? But if you say, hey, you as a person, what is your narrative? What are you going through? Let's talk about you and your story, and then let's talk about the impact that it's had on your body. So we manage through counseling, through medical practitioners. We can then manage the side effect, the impact, because the mind shows up in the brain. There's the toxic trauma. There's the mind processing it. It goes in the brain. When you build it into your brain, talking about frequencies, we talk about neuroplasticity. That experience is physically built into your brain, into the dendrites. And every part of that experience, and there could be 1,000 elements to that experience or 1,000 details, that's 1,000 toxic vibrations inside proteins that are affecting the entire frequency balance of the brain, the oxygen level, the blood level, which then goes down to every cell of the body. Yeah, of course you're going to have a mess in your brain and your body. So we need as many different approaches to managing that physically as we possibly can, but we certainly don't need the label locking in syndrome that has actually happened. It's made things worse. It's contributed to people dying younger. And really is, I mean, I can go on and on and on and on about this. You can get my drift. It is not good for us. We don't want to label, because as soon as you label, you're going to put that in your brain, you're going to create a predictive pattern in your brain, and there's tremendous cognitive dissonance, because I know I've gone through something. I should be allowed to be sad. But no, I'm not. Now there's something, I've got a brain disease. Now I've got to fall into another category. Now I've got more fear added. So the thing just gets worse and worse and worse. We have to stop that. And that's one of the big focuses of the work that I do, is to change that narrative completely and tell you it's okay to be human. Please accept your mess, embrace it. Because when you embrace your mess, that's when you get control of it. And the tormented to be mentored kind of thing starts happening. So I hope that
In
you can see
other
on my
words,
bandwagon there.
the psychiatric Bible, DSM 456, it's full of you know what.
Yeah, it should be a doorstop or
A
firewall.
doorstop, as opposed to a real Bible. Go ahead.
This is the
There you go.
DSM-5.
Look at that.
Why do I have this?
It's your Bible.
No, it's
Oh, I just was asking.
several years ago, I was writing a paper. Of course, anytime you're writing a paper, you're trying to sound intelligent, right? Impress somebody. But I was writing a paper comparing the biblical perspective on counseling opposed to the clinical perspective or secular. And listen, if there are any secular therapists or clinical therapists in here, I never disrespect your work or your training or your heart ever. But as I was looking at this book, it was 4 at the time, now it's 5. It's a very political book, by the way, as to what's considered a disorder and what isn't. Mm-hmm. Things get added, some things get taken away, et cetera, as the years go by. But I realized something as I looked at this 850-page book, is in this book, nowhere, disorder after disorder after disorder, does it say what order is. It isn't there.
Oh, good.
It isn't there.
Can I steal that?
May I say, this is, the book talks about what order is. Now, I'm not talking about theological theory or denominationalism. We talked about what love is. Love is patient and love is kind. It does not envy and it does not boast. It is not rude, it is not proud. It is not easily angered. It is not self-seeking, and it keeps no record of wrongs. It does not delight in evil, but rejoices in the truth. It always trusts, always hopes, always perseveres. Love never fails. Dear friends, none of those are emotions. Those are what I call character words, ways to be, not ways to feel. And as Dr. Leaf has said so effectively, so oftentimes, when it comes into the office the first time, well, I'm bipolar, well, I'm this or I'm that. Who told you that? Well, different people. They just decided somewhere along the way, or somebody told them, they guessed. And listen, that's a label that they wear oftentimes with a badge of honor. Because I have this label, because I have this diagnosis, there's no hope. Well, let's talk about hope and about how that can change.
Can I hit check on this? You know, when I found out, I was asked to be on this panel, and then I found out that someone I have such respect for, I've read so many of her books. So I thought, I better get to know her again from her books. So I read a couple of her books before coming. And I was reminded of something in one of her books. So when I would have a difficult patient, as cosmic as this sounds, just bear with me, okay? I always get up early in the morning. I get my cup of licorice spiced tea from Stash, and my dog Stanley, a standard poodle, would be by my side. And I'd go up to my roll top desk and I would pray about this patient. I believe prayer is where so many answers come from. And then I would get up from that prayer and I'd go to this massive amount of books that I have. I love books. Sometimes I even read them, and so it's kind of cool. But energetically, they gave me lots of things. And I would just walk along there till I felt something. You say, what did you feel? I don't know. I felt something. And I would grab a book. I wouldn't even open the book. I'd carry it back to my roll top desk. I'd spin it open, I'd stop, and I'd start reading. I cannot tell you the times I got the answers for patients, but I had a particular patient that had a neurological disorder. Thought it was MS, thought it was ALS. I never did help the guy, first of all, sadly. But the book I pulled out was Medical Embryology. And I spun it open, and I'm reading about a sperm and an egg. And I'm thinking, God? What's up today, you know? And it talked about that a sperm has a pulse and an egg has a pulse. And that those millions of sperms, they're flying all over the place, and this egg has this pulse. And one of those sperms, one of the sperm would fertilize that egg, and for a moment, which is the shortest time known to man, it's the word for the shortest time, for a moment, both pulses stop, and then they beat together. So when did life begin? The answer is right there. So it then said that almost instantly that one cell becomes 2, and 2 becomes 4, and 4 becomes 8, and 8 becomes 16, and the 16-cell embryo is called a marola. I'm a buckethead, so stuff like that sticks in my head. If you know my work, it's tough being a buckethead. But as it went on, and then the paragraph starts, in this whirlwind of activity, and I'm thinking to myself, this is not a term you read in medical textbooks, the word whirlwind. In this whirlwind of activity, there's a black mass that forms, and that will also start multiplying, and the exponential multiplication of these cells. And at a certain point in the embryological development, these cells separate, and this is to her book. I saw it in her book, which is reminding me of the story. These cells separate, but they're connected, and the top of this black mass becomes the brain. The bottom becomes the heart. So, James Allen, as a man thinketh, so is he. It's biblical. And if you ask our not a pastor, but he would say that's not what it says in the Bible. It says, as a man thinketh in his heart. So to answer this question, that first book he showed was people that thought with their brain. But these are from the same embryological tissue. We don't think with our brain, we think with our brain and our heart. The Bible tells us to think with our brain and our heart. And that is the answer to our health crisis. We have to quit thinking with our brain alone. She's an expert on the brain, but she's also an expert on the heart because she talks about this in her books, actually. I read it a couple different times. So thinking with our brain and our heart is the key. Men have a hard time with that because it's not natural for us to think that way. But if we did, we wouldn't have all the problems I think we have today, in my opinion.
Beautiful.
Can I add to
Sure,
what you said?
please.
Thank you for what you said there. It's brilliant. Both of you said such beautiful things. We wired for love, quite literally. And this concept you've just spoken about is called epigenetics as well, where it passes through the generations. So that related to your patient, I was just thinking of the concept of epigenetics. But we literally wired for love. A Nobel Prize winning scientist showed that all our neurology and our physiology and our mind, which is gravitational fields and electromagnetic forces that are around and through us, are all wired for survival and for love. So we're made in God's image, so that's love. And we can see that quantum physicists will show that we have these, we can see the different, there's a lot of research now that shows you that we are vibrating with these love waves. I mean, this is not something weird. This is pure science. It's the same technology. It's the same concept that makes your cell phone work. So basically, if we are wired for love, our brain and body are aligned to help us to survive. So we are also aligned to manage a lot of mess. Point is that we're not meant to stay in a mess. So our brain and body can handle when we get into some situation and we don't react like we should, which we do all the time, all of us. We don't always react perfectly, or we don't have ideal situations happening to us, life. But our body can handle that as long as we manage it. So the wired for love notion is that we are also drawn to the negative to restore it back to survival, to balance. And that then is all reflected in how our body is working in our mind and our brain. So when we talk about the heart and we talk about the brain, the heart and the brain are physical. They can't do anything without the mind. So if you're dead, your brain can do absolutely nothing, nor can your heart. But when you're alive, it's your mind that is driving how those work together. So the brain is responding in a certain way, and the heart responds in a certain way, and there's all this connection, there's the gut-brain connection. Everything is connected in the mind, but the mind is driving the whole process, mind to brain to all the different parts of the body. So when we operate in our optimism bias, which is our wired for love nature, we're drawn to things to rectify them. That's why we're not drawn because we're evil or something like that, or there's badness in us or something. It is we're drawn to rectify. Based on that, the way a person shows up is because of something. So even that what you would consider the most terrible person out there with terrible behaviors or whatever, that is not who they are. That is how they are showing up. That is not their wired for love nature. There's a reason for that. And that whole way that they're showing up has got an emotional component, it's got a physical component, it's got a behavioral component, and it's got a perspective, an attitude component. And those are all warning signals. So therefore, the feeling part, the emotional part, are warning signals. So coming back full circle to wired for love, you can't actually have depression. You cannot have anxiety. Now hang in there. Don't think I'm not saying anything. Just listen to what I'm saying. You can have cancer. You can have diabetes. You can have a brain tumor. But you can't have a depression, because depression is not something, it's not an it. It's an emotional warning signal. So your mind, brain, body. So when you talk about the heart, brain, and what you've just explained so beautifully, we are talking about a design as humans where the mind, brain, and body are designed to work together to help you survive. So how do I tell you, if I'm your mind, brain, and body, that there's something going on in your life that you've stepped out of your wired for love mode? Signals, red flags, okay? As Todd said earlier on, we're always in a state of stress. I mentioned this last night, stress will switch into toxic stress if we don't read our red flags. The red flags are these signals. So my brain and body, your mind, brain, and body, psychoneurobiology, that's what it's called, mind, brain, body, is working all the time to help you to recognize, why are you showing up in this way? If it's threatening your survival, do something. And that is why your body gets sore. That is why emotions are so hard. They're not bad. They're telling you something. So if you run from them, you'll get worse. But if you run into them and read the emotional red flags, the physical red flags, which is your body, the behavioral red flags, and the perspective red flags, you will be able to tune in the self-regulated way to what is going on inside of you, because that is not who you are. There's a reason. Do you hear what I'm saying? Those signals are calling you because of your wired for love design. When Todd talks about the heart and the mind, when we talk about following the scriptures or following the philosophy of the scriptures, we are talking about, this is here to work for me. So if I'm not right, what are my signals to get me back into being right? And if you pay attention to those, you are operating in your wise mind. I talk about the wise mind and the messy mind. You're operating in your wise mind to bring you back into that wired for love nature. And that's what we've got to do. So it's not a matter of your brain thinks one way and your heart thinks one way. That's kind of metaphorical for the fact that you have a wise mind and a messy mind. And while you're alive, they're designed to work together. And when we do, we bring ourselves back into the wired for love state and mental health.
Beautiful, thank you. I was thinking about the medicalization question earlier about all of mental diagnosis being a mental aberration of some kind. We must diagnose it.
Yeah.
Of course, there's no blood test, urine test, any test for any of those to validate them, right? And then the symptoms we're talking about. Growing up in pharmaceutical medicine and allopathic medicine, every symptom that I experienced as a young child to my young adult years were interpreted to be evidence of a deficiency of some chemical cocktail, for instance. And that's true also of our emotional and mental states as we go into psychiatry, which used to be, going back decades now, more talk therapy, where there was a benefit to unburdening yourself, things that you were stewing over, trying to digest. if you will. Interesting using terminology that's physiological, digest emotions, that kind of concept as well. And it fascinates me to no end that we can have this discussion as well, but I would encourage you, like Todd, that was a brilliant thing you did, this prayerful, how do we ground prayer into a sign, something that we can make real for us here, right? When we're like, I'm not sure what's the sign from God. You pray and then you walk by the books and you feel, what is that book? You open it up. Could be the Bible, of course. Many people do that already with the Bible, but it's not limited to that. If you're on a subject looking, what is it that I need right now? What is that guidance? Can I open up to that? It's a beautiful technique that's pragmatic and practical. And that's the kind of thing. The things that are known here on this panel can be applied immediately because they are so practical. That's why I love about what we're learning here today as well. Any other questions from the audience? Yes, ma'am, right up front. Can we get a microphone so we can make sure we get it on recording as well? Stand by. Thank you.
Where'd your camera go? You want me to hold it up for you?
No, thank you.
Okay.
Go ahead. Thank you for being so kind.
Yes.
Thank you. Yesterday, I also have two questions. So the first one is, if the person is vaccinated, jabbed, and if you tell him how bad it is, he's gonna get very frustrated. If you're not gonna tell him, you're gonna feel guilty because you didn't tell him to heal himself and not to get the following 5, 6, 7 jabs. So I still can't figure out the golden middle, how to approach this person. And one more friend say, for some people, they're so anxious, they're so scared to get whatever COVID thing. And for them, it gives them peace of mind. I have a jab and I'm not gonna die right now. So they feel very peaceful, and you don't want to ruin this peace, because if you tell them, he's gonna kill you, so then they get more frustrated and you create more karma this way. So that's question number one, what you tell these people. And the question number two, it's about the same category of people who got for all their life brainwashed with TVs and with the doctor's opinion, and they so brainwashed that they cannot, their mind is so full of that bad information that it has not enough room for the good information. And they say, how you believe all those people, and I don't know how to also access this question.
You painted two brilliant, beautiful dilemmas that many people are asking. This is a common thing that's happening right now, and trying to make a bridge to people that you do want to help. You're not trying to harm them, but at the same time honoring those dilemmas. I don't know if there's one answer, but I'm certainly fascinated to hear if anybody has perspective on that.
I think we need a spiritual input on this one.
Maybe.
I'm trying to get my thoughts together, so I'm stalling here.
Break past the buck.
Dr. Leaf has used a phrase that I really like, even from last night, and that is listen to their story. And there is something about everybody that I've ever met wants to be heard. And I think one of the most helpful ways of helping a person dial back where they are. By the way, I am a lot more concerned if a person's emotions don't fit the situation. If they've transfixed their emotions in some way that it doesn't fit the situation. If it's a sad situation, they need to be sad. Oftentimes it turns into anger and different things. But the time it takes to listen, to look at them in a meaningful way, to ask good questions, tends to start helping them dial back whatever emotion is amping up in their heart. That's a skill that it's not natural with everyone, especially we guys. Have you noticed that, guys?
I notice women are more.
But it really is very, very helpful to listen and to listen well.
Thank you. Yeah, I agree with you about guys, because I know so many couples when husband get a shot and wife didn't. So many.
Yeah.
for some reason.
It's another area of, again, the word frustration comes to mind again. And then what do? Do we fight it? Do we get depressed about it? Or do we, as Dr. Evers says, can we listen? What is it that's really happening? And we don't allow often, men, but not exclusively, the time to actually listen to what is going on in their spirit, right? Where are they mentally and emotionally?
Like unfolding the root emotion, right? What causing this?
Any other techniques?
You know, Bible says we're fearfully and wonderfully made. So all these predictions that we're going to have this massive increase in these diseases, we're going to have this massive death if we don't do the vaccines. Look, nobody knows the answer to that except God. So the key here is with vaccines, you know, I have, even though I'm retired, I have patients that won't let me retire, and you'll find this to be the case. They'll call me and say, my daughter-in-law won't let me see my grandchild because I'm not vaccinated. The problem I have with this is if you buy the vaccine premise, then you don't get the other side of that argument. You can't have both sides. If I'm vaccinated, I'm safe. You can't say if I'm not vaccinated, I can't be around that person. You don't get both sides of that argument. So I always say you can't fix stupid in that situation, which you can. So a lot of this is stupid. But really, we're probably not going to see the massive amount of deaths. We're probably not going to see the massive amount of reactions because we are fearfully and wonderfully made, and our bodies are built to take this kind of hit. So we will be able to survive this. There are people that are going to take a hit. I get that. And sadly, it's happened. We see it with autism and mercury toxicity and all that kind of stuff. And you got one group says that's absolute lie, and another group says that's absolutely true. Somewhere in between. It comes down to the susceptibility of the host. Where are we in our own health? If you're unhealthy, you're more susceptible to taking a hit. If you're more healthy. And I worked with a lot of NFL players. And I was in St. Louis, and so, you know, obviously they had the Rams there. And I remember talking to one, he was a lineman, and he said, why is there so much concussion in these young players and this brain disease? What's the chemical that they're measuring? In the concussion, they're finding something in the brain. I keep thinking Lewy body dementia, but that's not it. Junior Seau, well, you know, he's 44 years old and he kills himself. So I did a lot of research on this, and it turns out that old football players, the amount of dementia percentage-wise was no greater than the rest of the population. We all know the Mike Websters that had all this kind of stuff. And I had to ask myself, why? And the why is neurotoxicity. When we're taking aspartame and all these chemicals that are neurotoxins into our brain and damaging the brain and then take a hit, that is where we're going to see the problems. And that's why there's so much grade, because we have a susceptible brain taking a hit, not a healthy brain taking a hit. I don't know if I'm right. I think I am on that. She's probably the expert on that. But I once had a young lady who I had treated, very vibrant, very healthy. Hadn't seen her for about 4 or 5 years. She came in, she aged 20 years. And I'm going to give you a title of your next book too, although we may have to co-write it. And she had this horrific story. And, you know, her husband left her, and her son got into drugs and all this kind of stuff. And she went through all this all these things, and she was diagnosed with depression, anxiety, bipolar, schizophrenia. I mean, all these medications. And she was the shell of who she was. And this beautiful creature wasn't there. And she says, Dr. Todd, what do you think happened? And I said, I think you had an emotional concussion. And I snapped to attention, and she said, is that a real thing? And I go, that's never come out of my mouth. But I believe the emotional hits that we take concuss our brain. No different than falling off a ladder and smacking your head on concrete. I don't know if that's true. I could probably get the authority here. But I think we have emotional concussions. And I think what's happening now is concussing the brains of humans. And we're not normal. What's happening now is not normal. The way we're treating people is not normal. There's something wrong. We've gone off in the wrong direction. So I think these emotional concussions that are occurring are going to have more damage than a reaction to the vaccine. So that's my concern, and I turn it over to you on that one. Should we write a book together?
Yeah, sounds like a great idea.
Emotional concussion.
The emotional concussion.
So good. The compassion that's come out of all of your answers are beautiful. The question has come from a place of love. and I'm going to answer from a place of love. And that is that true love is the ability to agree to disagree. And that is so important. And that's what's not happening. When you feel very passionate about something, the most natural thing is to get other people to come along with you. And that is our wired for love nature. But as you so correctly said, and as you've described as well, everyone's at their own place. And we have to respect that. Part of being a human is respecting where that person is. I am vaccinated because that is my point of view. That is the position I've taken. I would never force that on anyone else because that's the decision I've made from a medically informed position. The decisions I've made, I have numerous. I don't expect you to agree with me, but it doesn't mean that I can't sit down and have coffee with you or be on a panel and have a great discussion about mental health, because I'm far more interested in your mental health than I am in your physical health. Now, hear me correctly. Why am I saying that? Because your mind is 99% of who you are. So you can have a cancer medication, and if your mind is right, that medication won't destroy the cells like it does. And there's endless research on this. People having knee surgery, but there's no actual knee surgery, and their body improves. You're making 1 million new cells every moment. So my thing is, let's learn to operate in love. Let's stop getting so impassioned about, they must do what I believe. Forget all of that. Let's start agreeing to disagree, and let's start loving again. And when we immerse this world in love, you heard the frequencies, 5 times the amount of love. I've done research in this area too. I see it in the work I do on telomeres, which is basically is a direct response to how we manage our mind. And if your telomeres, which are the ends of chromosomes, are not functioning properly, you can't function as a human, and they take a hit every time you operate out of love. So if you're getting mad at that person who is vaccinated, you're causing yourself brain damage. You're causing your telomeres to be damaged. But if you say, okay, I don't agree with that point of view, like we obviously disagree on that, but it doesn't mean I can't love you and honor the fact that you have such compassion. I honor that compassion in you. I honor the compassion that I'm seeing at this conference. I honor the love. But I believe true love is the ability to agree to disagree. Your frustration will damage your telomeres, and your telomeres are in every cell of your body. You have 37 to 100 trillion cells in your brain and your body. And with every frustrated, angry response and getting mad about why are they doing this and why, you are damaging yourself, and you are wasting precious time that you could put out there into loving someone else. People respond to love. They do not respond to being pushed. They do not respond to an argument. I'm the only one and my husband walking around this conference with masks. Whether you think I'm crazy or not, that's my decision. You love me because you respect that. That's my decision, or you don't. But I know that I love you for not wearing the mask. It's your decision. Do you see what I'm saying? I am not going to fight with you. I refuse to fight with you because I'm not going to put forth that incorrect energy out there, and I'm not going to damage my own brain. And that's what I would recommend, is operate in love. Love always conquers all.
Amen.
Thank you so much. Can I clarify a little?
What, you want another question?
Just clarify.
The compassion ends now. No more. Go. All right, just tease it, of course.
Excuse me. Thank you so much for your answers. But Carolyn, you said agree to disagree, right? It means that you're telling the person the truth when he's, in my opinion, didn't do the right thing.
But that's your opinion, you see.
Yeah.
So I can validate my choice as much as you can validate yours. So why fight? Why fight? That's not going to help, because you fighting and me fighting, I reduce my immunity, I damage my brain, you damage your brain, we throw a whole bunch of the wrong ratio of love out into the atmosphere, and we damage a whole lot of other people, because one butterfly does impact people in China. One butterfly wing flapping. It is true. I know enough about quantum physics and the theory of quantum physics to know that the way I come into this kind of meeting or deal with this kind of question is absolutely vitally important. Every part of me loves the people at this table 100%, and every single one of you there, even if you don't agree with me. And I can sit down and still have coffee with you and not have a fight. And that's the most important thing. It doesn't matter that I don't need to force my opinion on you. I respect your opinion, and that's what I'm talking about. That is how we get strong. There's so much evidence showing that if I immerse myself in this kind of love, I am building myself up so my immune system is strong. And if I immerse the people in that kind of love, if I give that love to you, I've just boosted your immune system. And if we had a fight, both our immune systems have just been shot. So there's the thing. So Have your passion, but don't force your passion on other people.
Yeah, I agree with that love. But do you say anything like that you did something wrong or
There's
not?
no rules. There's no cookie cutter approach.
Okay.
There is love. Love will dictate
Okay, whatever
the pace.
heart tells, do
Love
that.
will dictate the pace. If people are getting worked up and there's an argument starting, there's no love.
Yeah.
That 5-to-1 ratio. is
You
being
can
shot.
sense the vibration the moment you bring out a
Yeah.
word that, oh my gosh, I can feel that's not the love, right?
I felt it, as I said, the vaccine, that I'm vaccinated. I felt the jolt from you in the room because most of you aren't vaccinated. But I am, and I'm proud of it. And I'm also proud to be here, that I can come to a conference where people are anti-vax, most of you, and you have reasons. I honor that, absolutely, utterly. And I'm pouring all my love, so much love that I'm protecting you and me from the kind of love I'm pouring out. That's what I'm talking about. Because we will always all disagree on so much stuff.
Oh, there's always going to be something. You can go to everybody in
Exactly.
your church and you ask them enough questions,
They
you're going
will-
to find something you disagree about in the Bible even. And what are you going to do then? Oh, I quit? No, we got to bring that love that we are encouraged and commanded, if you will, or guided to. I think two words come to mind in some of this discussion too. Attachment and surrender, interestingly enough, because we love someone so much that we don't want to let go of the possibility that they could be hurt, because I know what's right for them, even in a, and again, within families, it can be the most difficult. And there's that point where you realize that if you push further, then you get out of that love, you get into that anger band. And there's that point where I pray and I turn that over to God. That's genuinely something I have no control over. I say, God, I love this person. This is how I feel, but I'm going to put those feelings to you. You can handle it. I can't handle it. And then grace sometimes comes into a situation, and you see a beautiful thing happen that you couldn't have talked your way through. A miracle occurs when we do that turning it over to God at that moment.
You can always start out by saying, my humble but correct opinion is.
That's Todd. Go Todd. Dr. Evans.
Yeah.
Like I'm not always right. I just have better ideas.
I'm going to steal that one too.
Here's the thing. I think that I found to be true is that time is a healer also, not just time, but because it takes work, it takes effort. You hear time heals all wounds. Nah, I don't think so. I don't think so. I think it takes on purpose thinking, reading, prayer. I actually did my doctoral dissertation on the impact of prayer among pastors and their wives. I created a survey and had them fill out the survey about their prayer habits, their Bible reading habits alone and together, and asked them a lot of pretty intimate questions about their prayer habits and Bible reading habits. These are pastors now in the state of Indiana. And at the end of those questions were 8 questions from an instrument called the Marriage Satisfaction Survey, a really well-established measurement on how satisfied you are with your marriage. And so I compared the answers to the prayer and Bible reading to their answers on marriage satisfaction. I'm not going to surprise anybody in the room when I say that the more frequently couples prayed together and read the Bible together, the more satisfied they were with their marriage. Very practical measurements: money, friends, time, sex, very practical measurements of satisfaction. And the more frequently, interestingly enough, while 75% of the respondents said that they prayed together at least once a week. These are pastors now, once a week. The number that responded that they read the Bible together cooperatively was, you couldn't even measure it. Why? There were a variety of, pardon me?
Is there such a thing as a part-time pastor, maybe? Are they part-time?
No, full-time church pastors.
Wow, okay.
And so it's something Terry and I discovered many years ago, is that it changed our marriage. And so I would say to those of you in the room that are married or are thinking about getting married or maybe doing it again, that's a very tangible, doable thing to do. to take the time. Well, we're busy. Yeah, we're all busy. But take the time to pray. If you think about it, it makes perfect sense. The Bible says to be one flesh, right? No longer two, but one. Well, what better way to start your day than praying for your husband, for your wife, for their productivity, their blessings, their protection for the day, and each other, reading a few verses out of the Bible every day. Or Terry probably and I pray average 4.5 days a week. I'm not sure that a half day works, but we don't get 5 most of the time. We're busy. But see what I mean? It does matter in the very practical aspects of our life to take the time. And the answers I got from the genders was fascinating. The pastors almost saw it as another ministry obligation. The wives saw it as a relationship. The wives saw it as he's sacrificing time for me, and that meant so much to them. So prayer and Bible reading, you would expect to hear that from me, but it's real.
Can we say happiness then becomes a habit, much like you establish something maybe awkwardly at first to do this? It's an effort, and then suddenly it becomes a natural part of your extension of your life, and that manifests in the way you've described in those responses.
Well, certainly. Again, my wife and I, raise your hand, Terry.
Hi, Terry.
Blessed among men, guys. It does become a way of life, and it's not a burden anymore. It's a fulfillment. It's an addition to your day. That if you don't participate, you know something's missing. So it's interesting to try to empirically study something of the Spirit. It really is, but it's important. So.
Hey Terry, this guy's all right. Good guy. I know this. He's a good guy. Beautiful. Now, what about other things to do together? We talk about mental health. How do we find that joy together? And not just in spousal relationships, but coming together and finding joy again, celebration, singing, dancing, things that we've done for time immemorial as humans that are now being subjected to scrutiny and derision. If you do those things, somehow it's kind of a bizarre time in that regard. You know, the things that you talk about, Dr. Leaf, as well, have happened forever. Issues of mental, let's say, stress that results in anger and other things. But can we, even in the midst of this, while others are looking at us and trying to judge, just like we were talking about, the judgments that go back and forth, to find a way to make that bridge so we can come together as humans once again? How can we make that happen? Is it a matter of reading a book, or is it a matter of putting all of this into action? And if so,
I believe, if I could answer that, just start, there's so many things, but the foundational key there is what I was saying earlier on. You're not going to have any love between anyone unless you actually accept the other person where they're at. And Jesus demonstrates that in the garden. When the whole of mental health is demonstrated so beautifully when Jesus goes in the garden. You always think it's the whole story, but what actually happens is Jesus is demonstrating mental health and relationships so clearly, because you've got to face your issues. And Jesus got in the garden to face what Jesus could only face, and went through everything, and we don't really understand what that means, but we know that every emotion and thing that we can go through was experienced. And there was a time, there was a processing, there was a going through, there was a time when Jesus then turned to the disciples who'd fallen asleep, as we know, and didn't say, give me Prozac, give me opioids, give me this, take me out of here, do this, argue with this. It just said, can you be with me? So there's none of this, I need your opinion, I need your this, I need that, you must do this, you must do that. It was simply, can you be with me for who I am? Can you value me enough as a human that even if you don't like what I believe or what I'm doing, that you can just sit and hold my hand and be with me? Even if you don't understand me, can you be with me? And that's what we're not seeing in this world today, in my opinion. That is really what love is. It's like all of us, there's no one who isn't in the garden, but people keep running out before they've dealt with the stuff. Stay there, go through. It'll get worse before it gets better. Get the support on the way. No therapist, no counselor, no pastor, no neuroscientist can fix you. Only you manage your own mind. You can go 3 weeks without food, 3 days without water, 3 minutes without oxygen, but you cannot even go 3 seconds without your mind working. It's even working at night. So if you don't manage your mind through processing through life and and allow others to manage their mind, and do it in the support way where you're not trying to fix other people and change them, but just support each other, that's when we will find peace. That's when we will get into peace in the midst of chaos. And in that, allow the arguments. You can't repair and grow in a relationship unless there's a mess first. So stop thinking it's bad and evil if you disagree. Just be decent about it and then repair it and grow. Or if you shouted at someone or got irritated, acknowledge and say, hey, listen, I'm just having a bad day. I'm sorry, I shouldn't have. Whatever it is, own it, repair the mess, move forward. So that for me is key.
Was it Bill and Ted said, be excellent to each other?
Be nice again, be nice.
You know, I'm reminded what Dr. Jim said. When I was a young and brilliant doctor, so only one of those adjectives was actually accurate. And I had this little old lady come to me. She was in her 80s, and this was the white glove after Easter kind of gal. You know, you don't wear white gloves still. You'll remember that, I'm sure. But I was taking her history on her, and I noticed that in 1964, she wrote down she had glioblastoma. For those who don't know, it's the deadliest form of brain cancer known to man. There is no survival rate, basically. And so I noticed that. I said, I see that you said you had glioblastoma. You must be mistaken because you're still here in the 1980s. And she said, no, that's what I had. So I took a little more history and I went back to it again. I said, now, you gotta understand, this is a pretty serious condition. And obviously, I don't think you had that young and brilliant again. And she said, no, that's what I had. And finally, I came back. I called her Miss and Miss. She'd never been married. And I said, now, Evelyn, you obviously are incorrect here. This is a deadly form of cancer. There is no survival rate. Obviously, you did not have that. And she took her little white gloves in her hand. She leaned forward and she goes, Sonny. She said, I'm an educated woman, been a librarian all my life. She said, I read about the disease. She said, I truly understood the gravity. She said, I knelt in prayer and I went to bed and I woke up and I thought, I'm not going to participate in that disease. She died in her late 90s. For a young, brilliant, I'll give the real truth, the young, stupid doctor, what a lesson I got. And I looked at her and go, you can do that? Now, had I read her work prior, I realized, yes, you could have done that. She absolutely changed the chemistry of her body. Changed a tumor that is the deadliest form of brain cancer by not participating in the disease. Amazing lesson for a young doctor. Never forget her forever.
Beautiful story. Thank you.
Yeah, great.
And it's the concept of what if they threw a war and nobody showed up?
Yeah.
Right?
Yeah.
Imagine that. Wow. Imagine that. And that's what we're. Yes, sir. We got a question toward the back there, and then we'll come to this young lady here for that.
Hey, good afternoon. My name is Glenn, and I have a son that has schizophrenia. And I don't know if any of you on the panel are familiar with Dr. Lauren Mosher. Dr. Mosher did it, and it speaks to you, Dr. Leaf. Dr. Mosher put together what's called the Soteria House. Soteria is Greek for deliverance.
I know Soteria House, yes.
Soteria House.
Moshe, you said Moshe, Dr. Moshe, yeah.
Yes. So and that goes right into love. So instead of medicating, instead of doing anything, what they did with these patients that have schizophrenia, severe psychosis, they accepted the auditory and visual hallucinations, and they worked through them, and that must be horrible. I don't see that, but it must be horrible for you to see that. You would experience that. And with love, they had a 100% cure rate in everybody that went through that house.
Wow.
So I think that's important that you know.
I'm so glad you brought that up, because also it was shut down, Soteria House, because of the fact that there was no drugs involved, and it was based on love, and it's the philosophy that goes against the current psychiatric movement. And I mean, I know there's one in Canada, there's a Soteria House, but there's a lot of movements now that they're bringing in those principles. But to say to someone that they have schizophrenia is already, once again, that labeling thing, that predictive pattern. When someone has hallucinations or delusions or whatever, they are down that extreme state. I mentioned a scale last night that most of us are operating between -4 and +4, but sometimes life accumulates and just too much, and we go down that, we go into more extreme states, and that's when you'll see the catatonic states and the delusions. And that does not mean that they're crazy. It does not mean that they have a brain disease, that they have to be on lifelong medication that causes cognitive damage. shrinks the brain and damages the brain. What it means is that they are really traumatized and they need support. They need the therapy. They need the time. And when they applied those principles to Terry House, there was another few studies in the late 1800s where they also applied the same concepts. Those episodes which were coping mechanisms in response to the severe trauma where their mind broke and the damage was in the brain and the body. It takes time for that to heal. In a loving environment, they heal. The scientific studies actually show that the way to heal from that extreme state is through giving a person time and immersed in a very loving environment where they can talk through to get to the root cause of the issue.
Well, they put my son on risperidol and they put him on Abilify, and within 3 weeks I had a suicidal schizophrenic son.
There you go.
So we stopped everything.
I'm so sorry that happened to you.
Well, thank you, but it's been a blessing. We stopped everything,
That's
and
good.
we developed this method of feeding my son, and we developed an agriculture technology actually specifically for for feeding schizophrenics and severely psychotic people.
Wow.
And so we've learned a lot. But anyway, I just want to let you know, I'm glad that you knew about that. It was
Thank you.
100% with
beautiful.
love and acceptance.
Thank you,
100%.
thank you for bringing that up. All right, we got a question up here. Go ahead and raise your hand again so she can find you. Yes, thank you.
Hi, this is for Dr. Leaf. Thank you so much for your work. I really admire you and have listened to a lot of your talks and have your books. And I remember you sharing something at one of your talks, and I would wonder if you could just share that again about what happens physiologically when we worship together in light of connection and agreeing to disagree and the division that we find ourselves in and the loneliness, whether, isolation is self-inflicted or enforced, I think coming together and just agreeing to love one another in spite of our differences is really important. And I don't know if you remember sharing this.
Yeah, I do. There's very interesting series of studies where it wasn't specifically just the Christian religion. It was people coming together, even groups of youngsters being together and dancing and that kind of thing. Now, I'm saying this just with a side note that when I do believe that you've got to be very careful, and that's my opinion, you don't have to accept it. In terms of when at the height of COVID, I don't agree with all the shutdown stuff, but I'm just telling you that I don't think it's very safe for everyone to get together in closed environments when we haven't got things under control. So I say that with caution, but that does mean that you can still worship together and be together through Zoom technology, through social distancing, etc., etc. So I just wanted to say that the principle when you are coming together collectively, and now all of you that are getting angry with me now, remember the brain damage that you're causing yourself, okay? You don't have to agree at all. So let me just give you some love so that you can calm down, okay? So when we do come together and we agree to love each other no matter what, our brains line up, they literally synchronize, which is phenomenal. They synchronize, and that love wave that we see in the atmosphere, quantum physicists have done a lot of work showing how when people are very negative, you can actually pick up that impact in the environment, and you can pick up that impact inside, you can hit someone else with it. So if you're in an environment where someone's angry with you, for example, and you don't know how to protect yourself, you absorb that anger into you. And you felt that it's almost like someone's shooting a little BB gun at you. Well, it's Einstein's work. It's a photoelectric effect. It actually is these negative emotions that are actually negative vibrations that are coming at you. These electromagnetic light forces, this stuff is very real. So on the reverse of that, when you are collectively worshiping and believing in something together and whatever you line up, you synchronize the love wave. So when you think of the waves of energy in the brain, we talk about theta, delta, alpha, beta, gamma, and high beta, and what it looks like when people are synchronized. And it's obviously unique as well. There's unique patterns within the big pattern. But it's like going out to sea, where you go far out to sea and you have the huge big wave, and you come in and it's a little bit not as big as that far out, and then you come up closer to shore. I mentioned this last night. It builds, the white crest crashes on the beach, and then you get little waves and it goes back in. Now what we see when people are in agreement and in love, we see a coherence in the two sides of the brain, and we see this very healthy wave pattern. So no matter what is going on in that person's life, which individually as the thought comes up, it disrupts the patterns of the brain, the coherence of the brain. You get all kinds of things like, you get these fancy words called frontal asymmetry. And we see the rift in the brain and the body. We see it in the telomeres. We see it immediately in various different, these two doctors know exactly, nodding their heads, okay? So we see it immediately. But despite what you're going through, mentally and physically, when you get together and you agree, there's this overarching love wave that moves through you and brings peace, a sense of peace in the midst of chaos. And your hearts all start beating in rhythm. So when we're operating in love, our hearts beat in rhythm, and that's that heart-brain connection as well. Changes your microbiome. There's even research showing how it influences your microbiome, and it's just an overarching beautiful effect. So it's so important and that's why I'm so hot on being wired for love. That's why I'm so hot on disagree with me, but let's just be congenial about it. Let's be loving about it, because I know what that is doing in our brains and how we can then operate in wisdom. You have no wisdom when you may be so convinced that your way is right, but you have no wisdom if you're forcing your opinion on someone else. So collectively worshiping is a way of us leveling the playing fields and getting wisdom and acceptance, and then conversations can happen.
Beautiful. Thank you.
Beautiful. Awesome.
Yes, sir, up front. And then we have one over there. Yeah.
I don't have too much of a question. I just wanted to say thank y'all, because all of you are saying basically the same thing, a little bit different. You are telling us what happens when you do the things that Dr. Jim's talking about doing, and loving each other and how it treats us. And you show the vibrations in talking about that. You know, some people just need to hear that Texas Roadhouse is good and they go eat there. Others want to hear what the cows ate to make it happen.
Yeah.
But we all get a great steak out of the deal.
Yeah.
If you know what I'm saying.
That's great.
Guys, this right here was wonderful, and I just want to say thank you. And because I'm supposed to ask a question, I was honored in sitting with Dr. Jim last night while I listened to her speak at dinner. And I know they're both from Texas. And as we know, all thoughts have roots. You guys, if you ain't been to Texas, you got to go there. You got some roots there or something. Because you guys are geniuses. So whoever put this together, thank you so much. I just want to thank you.
That's
because this has been wonderful.
Really good.
That's it.
I'm an honorary Southerner. There you go. I grew up in Georgia for 30 years, even though I was born in New York City.
Well, does South Africa make me a Southerner as well?
Yeah.
That's right. That makes you a Southerner as well. Yes. We have a question here, and then we have one in the
I'm
middle.
south of the Upper Peninsula border in northern Wisconsin, so I am south.
Thank you kindly. Seriously, thank you. Go ahead, man.
Such a kind thing.
Two things. Dr. Jim, what's the name of your center in Indiana?
What's the name of what?
Your center? Do you have a center where you actually?
Yes, it's Community Christian Counseling, Inc. And we do in-office or what we call distance counseling.
Great.
You can tune into our website at cccth.org, and you can see who's there, choose a counselor, fill out all the paperwork, pay your bill, and then call to make an appointment. We're working with people really all over the Western Hemisphere.
Any age?
Any age? You know what? Theoretically, yes. Although if it gets too young, some parents will call wanting us to work with a 4 or 5, 6-year-old. Most of the time, most of that work is going on with the parents.
Okay.
But yeah, we work with a lot of ages. We work with a lot of adults that act like 6-year-olds too.
Yeah.
So
Why were you looking at me when you said
And then, Dr. Carolyn, do you have a book that you could recommend for parents that are struggling with teenagers that are dealing with depression and anxiety?
Absolutely. Well, I've got many books, but I'd recommend my latest one, the most recent one, Cleaning Up Your Mental Mess. And then I have an app as well called Neurocycle, and there's actually I walk you through, it's like giving you therapy, but there's a little mini neurocycle also to help parents to guide kids. And then I have a children's book that's being written at the moment. But I've got a lot of podcasts as well. My podcast is called Cleaning Up the Mental Mess, and there's a lot of advice on there to help parents with children. But book-wise, I would start with the most recent one and the app. We've got kids as young as 12 on the app, but once you understand how to use the book and the app together, you can adapt it. At this stage, you can adapt down to your children. And then, as I said, the material will be coming.
Brilliant.
Pleasure.
Wonderful. Now we had a question in the middle of the room there. Thank you for your patience.
Thank you, and thank you so much for all of your comments. Excellent on love and agreeing to disagree, and yeah, just to walk in love solves a lot. My question is, first of all, I have a 38-year-old with autism, mental retardation. He's been on a lot of meds and everything. My question, though, right now is we also have a 22-year-old, and he has he's felt the depression. I'm learning about that now, but he has really severe OCD. And, he was just desperate for some help. We didn't know how to help him. We took him to the Daniel Amen clinics. Have you heard of that? Last January, and they did the brain SPECT. And they just said all parts of his brain were just misfiring, overfiring, underfiring, all this. And they just started him on a whole bunch of supplements like GABA and omega-3s and methylfolate and lithium and Neurolink, Neurovite, all this stuff. He's been taking it pretty faithfully, but the OCD is still very much there. And the doctor was saying, well, he might have to go on medication too. He might have to do neurofeedback. He did neurofeedback for a couple of months and said it did nothing for him. Then he mentioned cognitive behavioral therapy, which we haven't done, but my son still just, the OCD is pretty bad. Like he will, when he works, he's gone to college, but he just feels so depressed and hopeless. And he said this OCD drives him crazy. He will literally come home in the evening and with his car, and he can see what he's done and what's happening, but he'll say, okay, I put the car into park. Okay, I put the car in the park, right? Okay. I closed the door, I locked it. He'll look over, he'll run his hand over the seats, he'll lock the door. Did you get the mail, Mom? Did you check, the FedEx in the front of the house? Is the door locked? Is this? And he said it completely drives him crazy, but he can't stop doing it, And this is with everything he does, even getting ready in the morning. And he said it's just torturing him. And I thought, we've been to all these top brain specialists, and he keeps saying, Mom, can you help me? And I just don't know what to do for him.
Sorry.
Go ahead.
First of all, my heart goes out to you. Thank you for sharing, because that wasn't easy to do, especially with, that's a long thing you've gone through. I worked clinically as a neuroscientist for 25 years, and I used to take on all of those kind of patients. No one else wanted to work with them, so they used to come to me, because you have to realize that it's never too late. So first piece of advice, when we talk about something like OCD, depression, don't see that as that's who they are or that they have it as a disorder. See it as a symptom. It's a warning signal. So it's a coping mechanism. And so in other words, it's telling there's a reason why he's showing up like that. It's part of a package. It's never alone. That's one of those things that the DSM is ridiculous about. They think it's all delineated, but everything is comorbid. So in other words, everything crosses over there. You can't really pass anything out. It's all one big thing. But that's the predominant pattern, the predominant signal. So I would start with OCD is the pattern, and then that's not who you are. That is you showing up because of. From there you go to the signals, and from the signals you then start deconstructing and reconstructing. So I don't know if you were in the talk last night where I showed you the tree. There's a root reason, or a series of reasons. And I found with a lot of my patients that had suffered severe sexual trauma, and I'm not saying there's sexual trauma, but severe bullying where there was extensive trauma that had been suppressed, OCD, it could even be some sort of medical thing that was never picked up that made them different. I mean, you guys can attest to that. And that root has to be sorted out. So as a parent, what I would recommend is to shift your language. When I had patients like this, every single patient that went through my practice, I would put them first, we would first work on identity. The most important thing is to put all those things aside and say, okay, this is who you are, because years and years and years of, you have this, you have that, you have this brain scan, this, all of that is overwhelming. There's the identity shot. So that's the first thing that I would work on is identity.
Okay.
And I have got a book. I don't work clinically anymore, so I don't counsel anymore, but that's why I do the books and everything. There's a book outside called The Perfect You, and there I really explain this wide full of notion I've been talking about and how to do work on identity. So that would be the first part of a therapy session. The second part would be brain resilience. It is the most unspoken brain building. It is the most unspoken mental health tool I've said that wrong. It's one of the most powerful mental health tools that is not spoken about, except I speak about it because it's a major part of what I teach. It's in the book Cleaning Up Your Mental Mess as well. It's that you still use the same system. The neurocycle is the system that I've developed. It's not a technique, it's a system. Into that you can put CBT, you can put all the guidance you would get from the medical doctors you're going to, the whatever approach you use. The point is that you want the mind to be organized so that it can get the brain wired correctly. The neurocycle needs to be used as a system of operation in your mind over time periods. And I mentioned this briefly earlier on and briefly last night. Your brain cannot rewire in under 63-day cycles. And for something that's been so established, it's a complex trauma, a complex coping mechanism, you're going to need multiple cycles. Some of my patients would spend up to 2 years. So that's 365 times 2 divided by 63 days. You're going to get, I think it's about 12, whatever the number is. That's how many cycles, just to try and find out what's going on. When I say cycles, is your son already knows that you've done those things, but there's the chasm, that there's this cognitive dissonance between what he knows is real, but what is driving. So what's driving is a neural pathway that is still connected to the mind pathway. When you go through anything in life, every moment of every day, you build that experience into the mind as a gravitational field. Your son has his experience, whatever it was, whatever combinations, in the mind gravitational field, in the brain as a physical protein tree, and in every cell of the body. And that is why you need all these approaches, okay? So it's in 3 places, and we don't realize that. So to get that out and to rewire, we work in specific cycles of 63 days.
And that's the book that
in the Cleaning Up Your Mental Mess, that's the other
I did
book.
buy that, so it would be helpful to have him do that.
The system is in there. The
with us.
neurocycle system is in the how-to. The first half, I show you some simple science of why you've got to do the 63 days. That is so key. Carryover is one of the biggest problems in any kind of clinical counseling. I'm sure they're great with you, then they go off and they don't do anything. Same with your patients as well. To get someone to carry over, and that's because if you don't shift the mind-brain connection properly and rewire properly, you've got to deconstruct and reconstruct. That takes time. Most people give up around day 4, day 7, day 21. Okay. Those are sort of the key places where people give up. The majority give up at day 4. It's so frustrating for doctors like this and for counselors, because you give all this great advice, but they don't persist. And then they keep coming back with the same thing. So that's all to do with wiring. It's not that the person's bad or that they're wrong. It's that they don't know. We don't talk about this enough. We're not telling people, listen, cycles of 63 days. Your son will feel so different. I saw this with my patients for 25 years. We now reach millions of people. So there's thousands and thousands upon thousands of testimonies that when you push through an organized system with whatever techniques and medical support you want within that 5-step system, over those cycles of 63 days, you will rewire the brain. You will rewire. And that OCD will then start, which is kind of almost like an addiction. Addiction's not a disease either. Right. That's your son's coping mechanism. It's basically a flight trauma response. That's what OCD is. It's kind of like a flight. I'm doing this. It's like to cope. So you basically, and it's not sustainable, which is what is happening as he gets older
it's
and
driving
older.
him absolutely out of his mind.
So you want to break that
use
down.
that phrase, but
I've said a lot, but I hope that makes sense.
Working on that book, working through that.
Yes, and I would do the app as well, because technology is great.
What is the app?
The app's called Neurocycle. You can download that on iTunes.
Neurocycle?
Yep, and Google Play, and that's where I literally walk you through the 21 days, the whole 63 days. There's audio, there's visual. We're upgrading at the moment. There's more stuff coming in. There's all kinds of mini neurocycles to help.
And you don't feel like any of the neural feedback or cognitive
No, those are great. But once again, anything physical, you are 90 to 99% mind. So and your mind's got to work through your brain, your body. So you have to have the input from doctors, from the medical profession, and doctors like that are sitting at the table with me here. You need the counseling. You need it all. But the point is that your mind is 99%. So you've got to get the mind working to make the medication work, to make whatever support system medically you're putting in place, dietary, exercise, that is not going to work. Research shows you'll lose up to 86% of benefit from the great work that people do in this field if you don't have your mind right. Your mind makes it work. So you want mind first.
Mind is first.
But you want identity as the first step, and you want brain building, which is using the same system of the neurocycle, but you're not dealing with trauma or anything in the brain building section. What you're doing there is you're actually growing the brain. We should all be doing it. I do 2 hours of brain building every single day with the research that I'm doing. So it's learning new information. When you build new information in the brain in a way that you can actually talk about it, that you can write an exam on it or whatever, you are building lattices into your brain, neural wiring in your brain that is so strong that it actually becomes like an insurance policy. So even things like we talk about gratitude, everyone throws it around. We all know gratitude's important. I talk about a 63-day cycle where you build in a gratitude network in your brain. So when you're collapsing in agony with something that's going on, has got enough energy to come back and create a resilient state. As soon as you're resilient, 1,400 neurophysiological plus responses will start working for you. So I'm all about brain preparation. And that's where you want to do the identity, the resilience, the brain, and there's lots of other little things that you can do in that zone. But
And when you say identity, like I always tell him, he'll say, oh, I have OCD or depressed. I'm like, maybe that's what you're feeling, but don't call yourself, you're not that, I'm like, you're a child of God, you have great value, you're a beautiful person. I don't like putting, I've always said I don't like putting labels of sickness on people. I don't like that.
No, don't do it.
Because they start thinking that and believing that, and that's like who they start to become almost.
It creates predictive patterns in the brain. So what you want to do, identity, quite simply in one sentence, is your unique way that you think, feel, and choose. Everyone has their own customized identity. And that's getting shot in the world we live in today with social media, with everything. So unless you have that as your foundation, every other bit of work doesn't work. That's why. First, who am I? How do I get resilient? And then I can do all this good stuff. Then I'm going to apply what these doctors are teaching me. Then I'm going to apply that. I'm not just going to have knowledge. I'm going to actually use it in my life.
We have to wrap up now. I apologize. We're out of time, but I want to say,
thank
Todd,
you.
Yes, thank you so much, Todd. Is there a way people can find more about you, get your book, things like that?
Yeah, so my book is called WTF. You can only read it on Wednesday, Thursday, and Friday. WTFWhyTheface.com or drtoddfrisch.com.
Okay, beautiful. And Dr. Jim, how do people find you? You're actually contributing to Trinity biblical coaching programs as well?
Yes, the founders of Trinity are very faithful Christian people, and they've been doing health coaching for years. And to add the wonderful addition of the biblical framework of coaching is very exciting for me. I'm learning a lot. I've discovered I didn't know it, but I've been doing a lot of coaching over the last 20 years because some people, you don't have to get into the weeds of their life. They just need some different ideas and some different encouragement. By the way, that's a lot more fun sit in my chair. Yeah, it's. I think it's going to be a wonderful addition to the curriculum.
Right. And Dr. Leaf, how do they find out about you?
Well, my website's drleaf.com. My social media handle, Dr. Caroline Leaf from Instagram. You can get everywhere. So it's
beautiful. And you can catch my broadcast 2 hours a day, 6 days a week, robertscottbell.com. And I'm so grateful. I feel a compassion and love here. It's palpable, honestly, what we've gone through in this regard. It's the first time we've ever done a mental health panel here at the Health Freedom Expo. And I think it was sensational. These folks are amazing. And I want to thank them. And I want to thank you all for being here. We're almost out. But bring that healing out into the world and you can make the change you're waiting for. Is that what you do? So thanks for being here.